All right. Hey guys, welcome to Mind Media Psych. My name is Dr. Ashvin Sood. I'm a board certified adult and child and adolescent psychiatrist. Stoked to see all of you. If you are new to our channel, Dr. Sobowale, Dr. Niazi, and myself are trained adult and child psychiatrists. We have MDs, where we went to medical school and residency, and we basically treat individuals with depression, anxiety, ADHD, psychosis, bipolar disorder, PTSD, you name it. And in our treatment, we do a lot of medication management. So we've decided to come to TikTok and basically talk about this in terms of an educational standpoint. We're not providing advice directly to each individual. It's more of medical education. And there is a huge disparity in mental health care. So we're not trying to sell you anything. We're not paid by Big Pharma or anything like that. But we want to talk medications with the general public. And if anyone has questions, please feel free to leave them. We are hosting these Monday through Friday from 6 to 6:30 p.m. Eastern Standard Time, and we pick a topic. Yesterday we did sleep meds, and we did a whole topic about that. Tonight we're going to do antipsychotic meds because a person in our comments said they wanted to learn about it. So we're going to talk about antipsychotic medications. So, what are antipsychotic medications? Well, antipsychotic medications are medications that treat diseases and mental health illnesses that affect mood, that affect perception of reality, that can affect anxiety. And these medications are typically heavy hitters, meaning when we prescribe these medications, they're often either used as an augmenting agent to treat very severe depression, very severe anxiety, or to treat psychosis or a severe mood disorder, particularly if it's an active manic episode in bipolar disorder. There are a whole slew of antipsychotic medications out there, and there have been a lot of, good based evidence with these medications, but every medication has side effects, and we are really kind of hit home on the point that whenever you take a medication, herbal supplement, anything like that even says it's organic, it's going to have side effects. It's going to have effects on the body. So it's important that you discuss that with your doctor. So, hey Don, thanks for, I don't know if you asked this question earlier, but we're going to talk about antipsychotics. So, basically, when we talk about antipsychotic medications, we think of the kind of first generation and second generation antipsychotics. When antipsychotics were created back in the earlier 20th century and they were used, the typical first generation antipsychotics came out, which helped with what we call positive symptoms in psychosis. These are positive symptoms are typically hearing voices, visual hallucinations, tactile hallucinations, things of that nature. And individuals who developed these symptoms would be treated with medications such as Thorazine or haloperidol or Haldol. These were first-generation antipsychotics that seemed to assist with reducing these positive symptoms. And when I say positive, I don't mean good. I mean positive as in they're very present in that person's reality. And so these medications were effective in treating these auditory hallucinations, visual hallucinations, delusions by reducing these symptoms. However, they had side effects. First-generation antipsychotics were known to cause, the majority of the time, what we call EPS, or extrapyramidal symptoms. What this means is that parts of what we call the the striatal area of our brain, which controls kind of movements, would get blocked, and these blocked areas would then cause rigidity or movements. It's what we call Parkinsonian symptoms. If you know somebody who has Parkinson's disease, you can notice that they have almost what we call like a flat affect. It's really hard for them to emote or express things. They can also have difficulty with moving their hands appropriately. They can develop what we call a pill rolling tremor, which is really important to kind of highlight. They can also have difficulty with stiffness in their bodies. I would talk to older psychiatrists psychiatrists who had prescribed patients who had severe schizophrenia with Haldol and Thorazine and different medications like this in the first generation class. And they would often say that they kind of almost look like puppets, like they were kind of stuck up like this, because this is blocking that part of the brain that helps with movement. Also, first-generation antipsychotics can lower the seizure threshold, which can induce, particularly could potentially cause a seizure if you have co-occurring comorbid conditions that could induce a seizure. So I say all this not to stop antipsychotics. I say this as these are side effects of medications, and every medication has a side effect. It's good to know and talk about that. So I'm going to quickly go to the questions, stop for a second. Some individual said I was on Thorazine. Yeah, Thorazine is a low-potency antipsychotic. It's often given sometimes for kids with severe aggression. And somebody asked, my son has been on a shot in Vega. Your thoughts? So when we talk about antipsychotic medications, and I'll talk about second-generation antipsychotics next, but remember, antipsychotic medications are not just given orally like a pill through the mouth. They can be given through injection. They can be given through sublingual, as in like dissolve in the mouth as well. The medications that are long-acting injections are typically given to patients who don't want to take their medications, or they tend to forget taking their medications. And when you have severe schizophrenia, or if you have basically a routine or a psychotic illness that's really affected your day-to-day functionality, it can be sometimes hard to take your medications. So there are long-acting formulations where someone can get an injection, such as Invega, which is also known as a medication known as paliperidone, which can be given to the arm. And when you give that medication lasts for a couple weeks. And so how are my thoughts on it? If it is helpful for somebody to stay on the medication, I think it's great. What you want to be really careful of when you give a long-acting injection is that person is going to be stuck with whatever side effects that occur with that medication for a long time. So you make sure that they build up a tolerance to that medication before they get the injection, typically. All right, so let's talk about second-generation antipsychotics. And let's talk about them in general. Second-generation antipsychotics were kind of brought about because the extrapyramidal symptoms in first-generation antipsychotics were pretty significant. And second-generation antipsychotics were kind of brought in to decrease that overall kind of like blunting, and that decrease that overall kind of like the pill-rolling tremors and things like that. In these second-generation antipsychotics, the most efficacious of them all is known as clozaril or clozapine. This medication has been used for treatment-resistant schizophrenia and is often very effective at what it does. However, often, if you are a very effective medication, sometimes you can also have the worst side effect profile. And clozapine has the worst side effect profile amongst second-generation antipsychotics, actually overall in general. And the reason is because it can cause severe sedation. It has the highest weight gain of all antipsychotics, so significant weight gain. Additionally, the biggest thing with clozaril is that it can cause what we call agranulocytosis. What is that? That's basically a drop in your absolute neutrophil count over time. And the absolute neutrophil count is what protects you from infection. So when your neutrophils go down, basically then all of a sudden you can be prone to infection. It doesn't happen in every patient, obviously. It's a rare side effect, but it can happen. And what patients typically have to do is have to get a blood draw, typically weekly when you first start it, and then every other week, and then monthly. So patients who don't want to get a blood draw and aren't going to go get their blood drawn, it's most likely clozapine is not the right agent. So in the second generation medications, right, they're not causing as severe extrapyramidal symptoms as we had talked about with the typical antipsychotics. But in the second generations, they can cause the side effect profile of what we call metabolic syndrome. Well, what is metabolic syndrome exactly? So metabolic syndrome is, and I see people asking about lithium and tardive dyskinesia. Lithium is a mood stabilizer. We're not going to talk about that today, but it's a great question. Tardive dyskinesia occurs in first-generation antipsychotics. It can happen in second-generation antipsychotics. So when you have prolonged use of a typical antipsychotic, or like Haldol, for example, and it causes basically an oral buccal facial movement. Your mouth kind of moves like this. over and over again. We would see this when people were chronically on antipsychotic medication for multiple years at a time, and often to stop that or try to decrease that, you would wean off the medication. There are also other medications that can help with that side effect called VMAT2 inhibitors. I'm not going to get into that today because it's way too complex for everything. But what we're going to talk about in terms of second-generation antipsychotics and what the general population may want to know about is these are the medications that include Seroquel or quetiapine, risperidone or risperidone, Abilify or aripiprazole, lorazepam or Latuda, and then olanzapine or Zyprexa. There's also a whole slew of new ones that are coming out that are very expensive, and I won't jump into them, but these are the typical second-generation antipsychotics. I see some people have said, yeah, I take Seroquel, I take Zyprexa. Well, second-generation antipsychotics, and the biggest thing is that they can help with the positive symptoms like the visual hallucinations, the auditory hallucinations, the delusions that can occur in psychosis. They can also be used as a mood stabilizer. If somebody has mania, they can help with mania. So in children and adolescents, we often actually add a little bit of risperidone and then add lithium, which is a mood stabilizer. But lithium takes a long time to work in patients or kids who have a manic episode. So risperidone can actually help and have mood stabilizing components. However, risperidone, these antipsychotic medications, right, they are effective for also negative symptoms in schizophrenia. Negative symptoms can look like apathy or avolition, like not getting out of bed, not having a change in your affect overall, not motivated to do much, not cleaning yourself, not showering for days. So overall, right, these are why second-generation antipsychotics have become more in favor. They help with both of these symptoms. They don't cause the extrapyramidal symptoms as we talked about initially. However, they have side effects, right? And I'm going to highlight that over and over again. The typical ones is metabolic profile, right? Metabolic syndromes. These would include increase in weight, increase in A1C or blood sugar, so risk factor for diabetes, increase in waist circumference, increase in blood pressure, and also increase in what we call triglycerides. These are all very important because as a psychiatrist, you want to be checking for these things in the bloodstream, getting your lipids checked, getting your A1C checked, because these long-term drugs can have that type of side effect in the body. And what can those things lead to? Well, diabetes, right? It can increase your risk of peripheral neuropathy. It can cause you, we think about like, right, high lipids, can cause worsening heart or cardiac function. Increased weight gain can increase the risk of obstructive sleep apnea. So these are side effects that as a psychiatrist, you always want to be looking out for, okay? See a lot of people saying, hey, I got Seroquel, I got Seroquel, I got Seroquel. Seroquel is an atypical antipsychotic. It works for both bipolar disorder and psychosis. It goes up to 900 milligrams, but typically at very low doses, people use it for an antihistamine to sleep or fall asleep. And as doses get higher, it's used as a mood stabilizer. And as doses get really high, it can be used as an antipsychotic. So I'm going to stop here for a second. I'm going to answer some questions if this helps. And then I'm going to focus on the antipsychotic medications. I know people are asking a lot of other medications about other medications that are outside of this class. I can talk about that in the following lives as best as I can. Tardive dyskinesia happens with meds like metoclopramide as well, literally seen with my own. Yes, metoclopramide is a dopamine blocker. It's often used for people who take it for nausea, and that can happen if you're chronically taking it. Lamictal is the best med I've taken as a mood stabilizer. What if antipsychotics cause anaphylaxis? Every single one. You know, it's interesting. I've seen people who say they have allergies to these medications. It can be very sedating. We often watch, and we often, if we give somebody who's agitated and aggressive an oral medication to help with it, we often give Benadryl with that medication to make sure that there's no allergic reaction. We also have a crash cart if anything happens where they start this antipsychotic and they're having difficulty breathing. But typically not everyone's allergic to each one. They can have the same profile, but it's a great point. My son has pseudo-Parkinsonism from antipsychotics, olanzapine. So olanzapine actually typically has least of Parkinsonian symptoms, but it can happen in people. What I often tell people is when they come to me and they say, I want to be on Abilify, or if I want to be, on, medication, antipsychotic that won't make me gain weight at all. All these medications have a slight possibility of causing a side effect, more than the others. But like, for example, Abilify Latuda said, hey, least weight gain. It doesn't mean that you won't gain weight. It just means that you're not going to gain as much weight compared to the other antipsychotics. So that's why it's super, super important that even if the medication is less likely going to do it, you got to keep an eye out for it. Okay. So are these meds just a Band-Aid, or do they permanently fix a person? Great question. So typically you're trying to figure out what you're treating, right? So if you have an active manic episode and you want somebody to get out of that manic episode, Risperdal can typically help patients, or Zyprexa can typically help patients get out of that manic episode quicker. And then a mood stabilizing agent is added as a long, stable, kind of long-acting agent throughout kind of the course of treatment. But if you have schizophrenia or something like that, these medications may decrease the delusions and decrease the hallucinations, but they're not necessarily going to take them away. So this is a very broad question for psychosis in general. I think this is one of the most important aspects, but when somebody suffers from psychosis, right? Psychosis is impaired reality testing, and that could be due to auditory hallucinations like hearing voices, visual hallucinations like seeing blurs in the sides of your eyes, hearing whispers outside your door. It can be tactile hallucinations or olfactory hallucinations, thinking that you're giving off a smell constantly or something of that nature. When these things occur, it's because our brain can't tell what's real and what's not. So our perception has changed significantly. And you're getting a million signals in your brain all the time. It's what we call abnormal salience. When things are salient, right, they're important. So all of a sudden, everything around us is important, and we really can't tell why. And so these medications help dampen the sound. The origin of schizophrenia is it's a heterogeneous, kind of like different genetic kind of illness. So it can be really hard, right, to go to the cause and fix those and decrease it. What this does is reduce the symptom burden. It does not cure, right? And that's the hard part about this. These symptoms aren't cured by medications. Their symptoms are reduced significantly with them. Hopefully that helped. All right. What about controversy of people who are Christian, like God speaks through the Bible? So I think somebody's talking about hyper-religiosity, and so it can be, that can be a sign of mania. Again, I guess I'll do the next episode on mood disorders, what we can do. So what is manic? That's a great question. Manic is basically when somebody has a slew of symptoms which causes them to have a change in their mood. Now that's not like a change in mood in just general, like you're happy or angry, but it's a distinct time period in which there's a decreased need for sleep, in which the speech is significantly pressured. It's almost like a hydrant with the water coming out of it, and that person can't stop talking. There's increased need to complete goal-directed activities, and I'm saying activity to activity to activity to activity. There's no stop. There is a significant distractibility from that baseline. When you're often in the room with somebody who's manic, you start feeling manic yourself. So that's often a way to kind of tell, like, something is going on here that's different. And this is different from baseline. This isn't just somebody's underlying personality. Think of mania as like somebody who's potentially it's like an underlying seizure that's occurring. It's not an actual seizure event, but the same chemical processes, the neurons are firing constantly. They can't slow down. So it's really important to get someone out of a manic event because you want to protect their brain. And so manic episodes can last for days, they can last for a month. You want to make sure a medication that you can give that can help get someone out of it. All right, I'm on Seroquel 800 for sleep. Is that a higher dose? Seroquel 800 for sleep is not typically a dose given for sleep. It's given for something else. I would talk to your doctor about what the indication of that Seroquel dose would be. I got off an antipsychotic and it was the worst time of my life, totally manic and spiraled. Yeah, so there's this thing, and I have my notes in front of me just to kind of talk about it. There's this thing called supersensitivity psychosis. It sounds more kind of like, think about your brain, right? Your brain has a ton of receptors in it. And when we affect those receptors, the brain fights back and upregulates other receptors. So the overall idea with antipsychotics is they block what we call dopamine receptors. And there's a ton of them, D1 through D5 receptors. Way too complicated for right now. But when you give an antipsychotic medication, you block a receptor, And what the body does is says, hey, you're blocking that receptor. I'm going to upregulate more because you're blocking. Now, over time, you've chronically blocked all those receptors, right? And they've upregulated a bunch. And you stop an antipsychotic quickly or something like that, right? All of a sudden, you have a ton of receptors and nothing blocking it. So dopamine can typically flood those receptors, causing all of a sudden an overactivation, and it can cause a supersensitivity psychosis where you can rebound right into impaired reality testing, auditory visual hallucinations, delusions, all these types of things. And so that can sometimes happen also in mood states or mania. So it's really important that if medications are stopped or anything, they're very gradual. You have an active conversation with your doctor of what you're experiencing and how you're feeling. All right. How does Seroquel treat Alzheimer's? Alzheimer's is not treated by Seroquel. Alzheimer's disease is a disease where there are multiple domains, such as memory, cognition, visuospatial aspects that are deficient or are declining, and we want to try to prevent somebody from, in those deficits in those areas, to become aggressive. We want to prevent that, or to help with sleep. Seroquel is often given sometimes to these individuals for a little bit of agitation, but we have to be really careful, in particularly geriatric patients, because there is a black box warning for atypical antipsychotics that there's a higher mortality rate when given Seroquel in older patients. I think it's like 4.5% versus 2.6% in placebo. And so you want to be really, really kind of careful, particularly in older individuals with an antipsychotic medication. Additionally, there's a higher likelihood of stroke in patients with antipsychotics, especially in older patients. So Seroquel is often associated with Alzheimer's disease because of behavioral disruption or issues with sleep. And remember, Seroquel at low doses has that antihistaminergic tone, so it can assist with sleep. But you got to be really careful because there are other side effects to this. All right, thoughts. We've talked about different medications. All right, so Haldol, what do you think of this medication? So Haldol or haloperidol is kind of the OG of medications for antipsychotics. I'm going to quickly go through my notes about Haldol. Haldol is well published and well studied, and a lot of people talk about it a lot of the time, especially on TikTok. It's often prescribed because it's easy to give. It's given both orally, it can be given IM, it can be given IV in the hospital. So it's very easy for giving people if they don't have access, right? They can't eat anything, or they're refusing to take medication and they really need to take medication. It has low weight gain potential, but it's limited because of that EPS and the potential for tardive dyskinesia. Typically, patients, it's kind of like doses are between 5 and 20. You can start very low with 1 to 5. It's typically a much cheaper medication that's given. The biggest side effects that we talked about was EPS. It can elevate prolactin. Prolactin is a neuropeptide in the brain. I'm not going to go into it, but it can elevate prolactin, which is something you should talk about with your doctor if you're on it. The biggest thing about it is that, it's a high potency typical antipsychotic. We talked about EPS. It can lower the seizure threshold that I talked about before. There are short-acting injectable versions of it. There are also long-acting injectable versions of it too. So if patients don't want to take their medication. Was found in 1958, so it's an older medication. Does Invega cause eyes to droop? I haven't really heard of that before. It can cause flattening of the face and the affect because Invega or paliperidone is a metabolite or risperidone, and so Invega is often, I have it right here, iloperidone. Invega is often given as a medication to kind of it's a long-acting medication, and flattening of the affect can happen, or flattening of the facial expression can happen with these medications. What is the mechanism of Abilify? So Abilify or aripiprazole is a medication that assists as an antipsychotic it's a second-generation antipsychotic. And Abilify is, a lot of people got really excited about it because it minimizes weight gain, but it can have a really bad side effect. It's called akathisia. This can feel like significant restlessness. Um, and sorry, one of my colleagues is on here. Help, I'm seeing a ghost of a psychiatrist floating in a black void. ADHD.MD, follow him. He's hilarious. He's also a child psychiatrist, and he's very, very well-natured and funny and knows his stuff really well. So please, please, please follow him. But Abilify or aripiprazole, great medication. It's often used for schizophrenia and bipolar disorder. The issue with it is that, it causes that akathisia or severe restlessness. So people will often be like pacing and walking up and down the halls in the hospital, and they're like, I feel really restless. And that can be really frustrating, right? Because that's not a comfortable feeling. It can also be used with depression. You can augment with SSRI medication. It can be used for Tourette's syndrome as well. Abilify or aripiprazole is typically dosed at 2, 5, 10, 15, 20 milligrams. It also has a long-acting injectable, so if patients don't want to take their medication or refusing to take their medication, the family can try to convince them to take the long-acting injectable. That is also a possibility. The most common kind of we talked about also is that there can be some anxiety, some insomnia with it. So think about like the other antipsychotics can be really sedating. This can kind of activate individuals. And it typically takes a little bit longer in the history I've seen. When you ask about mechanism of action, it has that D2 blocking aspect that happens with the other antipsychotics, but it also is known as a partial agonist for the 5-HT1A receptor. It's pretty complex for right now, but what that basically kind of might lead to a little bit of that activation. Sometimes, again, I'm trying to keep this as like generic as possible, but like this stuff gets really complex, right? Medical school residency, and one of the aspects is like when you give an antipsychotic like risperidone, or you give an antipsychotic medication like haloperidol, you increase prolactin. This can decrease the rates of prolactin. And one reason why we worry about prolactin is because elevations of prolactin can lead to lactation, and so that's the kind of aspect we kind of want to avoid. And so Abilify can prevent that. And so, yeah, hopefully that answered a lot of questions about Abilify. All right. Sorry, I'm trying to go through which antipsychotic is good for delusions or obsessive thoughts and loops. I mean, it really depends on how the patient does. Some people really like for positive delusions and hallucinations, they stick with the second generation antipsychotics. When we think of OCD, best data has been done with clomipramine plus risperidol. Clomipramine is a tricyclic antidepressant, which we're not talking about today, but that can help. And then risperidol is another kind of famed antipsychotic agent. Risperidol, why people like risperidol is because it has a similar profile as the first generation antipsychotic haloperidol, but it is really effective at what it does. It can actually be sometimes less. It can be a little bit more weight neutral than Zyprexa or olanzapine or clozapine. But the issue with risperidol is that it can also cause EPS or tremors. I've seen patients with bilateral hand tremors on it as the dose gets higher. All right, guys, what time is it? Because do all antipsychotics cause lactation? No, typically not. Abilify does not cause lactation. Let's see, what does ziprasidone help with? Great question. I didn't talk about ziprasidone or geodone because I don't often prescribe it. Ziprasidone is also pretty weight neutral in medication-wise. I find that the biggest side effect with ziprasidone that you want to be wary of is, first, it's an atypical antipsychotic. Two, the biggest thing about ziprasidone that people want to think about is that it can prolong the QTC. Well, what does that mean? The QTC is basically a part of the heart that helps with conduction, and if it gets too prolonged, it can be dangerous. It can lead to a thing called torsades. We are a little bit weary of that because we get scared off by the reputation of lengthening the QT, but the risk is often overblown. And this medication often should be prescribed more often, in my opinion. It's used for schizophrenia. It can be used for bipolar disorder. It comes in oral medication and IM medication. The biggest side effects is it can make you really feel tired. It can make you feel dizzy. With the QTC prolongation, you would get what we call an EKG or an electrocardiogram before starting it. Check the QTC, then repeat it after you increase the dose. And so it's often when we give it, we have to give it with meals. It needs to be eaten with, I think, at least 350 calories to increase the absorption of it. and it's not as significant in terms of weight gain. So guys, I've gone through a lot, and you're helping me kind of review the facts. I just wanted to let you know again, I'm going to jump off now, but follow us on Mind Media Psych. I'm Dr. Sood. I am basically an adult. Well, not basically. I am an adult. Sorry, my words are getting jumbled now. I'm an adult and child and adolescent psychiatrist, working with Dr. Sobowale and Dr. Niazi on here. We're going to kind of keep bringing you guys information about medications, sleep, ADHD, depression, all that type of stuff from a psychiatric standpoint, Monday through Friday, 6 to 6:30, just to go over education as best as we can. Whatever we can bring to you, whatever we can highlight to you, please leave a comment. And so the biggest thing is, I'm learning in here, so if you guys have information or, these side effects, it's good for me to kind of see it too, because obviously if I'm the smartest person in the room, I'm standing in the wrong room. So if you can, share your comments and feelings, it's great. My disclaimer about all of this is that I'm a guy on TikTok, and yes, I'm a physician, and yes, I'm the expert in this area, but I'm not your doctor. So the most important thing is, if you have medication questions, use this as a tool to teach yourself, and go to your doctor or therapist and talk about this with them, because they know you way better than I do. And do that with any influencer or anybody you meet on here, okay? It's the most important thing. Good luck with you guys. Wish you the best of luck. It's always a pleasure, and I'll see you tomorrow evening. Have a good night or day.